So when it comes to treatment for prostate cancer, what are some of the more common, and what, in your opinion, are some of the more effective?
For natural or conventional or both?
Either.
For either. Well, for prostate cancer, the best treatment right now for low-risk prostate cancer, low risk meaning, summarizing, the PSA is under 10. If there's a biopsy, there's less than 3 cores positive. They do not have a Gleason 7 or higher. There's certain criteria of what we're thinking is maybe a pit bull from a poodle. But assuming we're talking the poodle form, active surveillance by far is the best treatment. And in essence, what that means is not to treat. It means to track it. I can't stress enough, that in itself is a treatment, because to do treatment usually would mean surgery of some kind or radiation and problems. So to know how to properly track with active surveillance, that is an art form of a treatment that doctors now are just starting to figure out. More precisely about things to take, men often go and they buy Serenoa repens. That's the herb saw palmetto, commonly known as. That actually acts as a 5-alpha reductase inhibitor. Well, what that does is it stops testosterone from converting into DHT, dihydrotestosterone. Now, without getting too technical with this, my point, though, is you're taking an herb that's affecting the hormones, but is that really what the problem is with the cancer? So men sometimes go and they buy these natural treatments just, the health food store says so, and Dr. Oz said something, or whoever they heard with good intentions. But what are you really treating? If cancer comes in different varieties, how do you know what to treat? So there is no one trick. It really comes down to understanding the flavor, so to speak, or the personality of the cancers and watching them. Some of the best treatments, though, I would say, would be anti-inflammatories. Cancer is often begotten by prostate cancer. By inflammation. So anti-inflammatories, curcumin is a fantastic one. Liposomal forms of curcumin or turmeric, excellent. Fish oil, it sounds like a cliche, but fish oil is an anti-inflammatory for the body and an anti-cancer. At the same time, flax oil. Flax, freshly ground flax, is fantastic because it has what's called lignans. And lignans are very unique to flax seeds. So it has the oil for the prostate and the lignans that help kind of drive it into the prostate at the same time. So these are some standards. Antioxidants are fantastic because when you have inflammation, you create damage. The damage tends to be oxidation, and you want to reverse that. So, and then lastly would be botanical medicines that help balance the hormone pathway. One last I do want to throw in though also is 1,3-beta-glucans. Those of course help stimulate the immune system, and for whatever the reason a cancer is there, even if it's a low-grade cancer, but to have your immune system kind of get an extra boost in the law enforcement department to take on renegade cancers is always helpful. So that's the natural. Conventionally, that's a whole loaded area, but I would say that unless it can be determined that a cancer is on the verge of being metastatic, then rushing to surgery is something we might want to avoid. But there is two components to understand with prostate surgeries. There's what's called a radical surgery, which means they remove the whole prostate. There's another group of surgeries or procedures known as retention treatments. That's where they keep the prostate, they just kill it from within. All kinds of creative ways of nuking it, frying it, radiating it, what have you. So one is you remove it with like the robot, you rip it out. The other is you use things like cryotreatment, HIFU. Many people watching this will probably have heard these procedures. So there are two classifications. And the reason it's important I'm demarcating these out is that the open surgery has an advantage. And that is if you want the maximum chance of getting all the cancer, then you remove the prostate. The flip side, like a yin and yang, is you also have the maximum chance of having side effects because you just rip this gland out. At the same time, the retention treatments are the antithesis, meaning that you have the least side effect risk because you're not ripping it out, but you also have slightly more of a risk that because you didn't remove it, some of the cancer might remain, and hence that could be there. So there's no perfect formula for anything, including natural treatments, but it's finding what's right for you. And the last point I'd say that on that issue, though, is that men are very angry sometimes when they have a treatment that doesn't work for them when it's forced on them. But if a patient decides on their own by looking at all the evidence and all the options, and they calmly, without that pressure of a doctor scaring them into a procedure, but if they make a decision, regardless of what it winds up becoming, no matter how bad the side effects are, they never go through life angry. Maybe a bit disappointed, but they don't have that rage that can consume them for further healing.